past 10 months, I think, have been draining for everyone in the NHS, but they've really emphasised the core role that information provides.
So it has been a very long year.
And I think it's shown us where we need to develop and change.
Exhausting, hard work, tiring, but also thrilling.
It has been a massive learning experience.
A roller coaster of working at home, homeschooling, trying to factor in all the rest of my team's personal circumstances. But I think out of that we've achieved some incredible things, and so we should be very proud.
So it's been hectic and difficult for lots of clinical staff working in lots of different areas that they didn't know well.
Most of IT has been dedicated to supporting the pandemic, so a lot of the technology that we've been working on has taken a back seat.
It's been hugely intense and a journey of discovery.
At times it's been quite hectic, quite difficult, quite emotional, but it's been a time full of change, and there's been a lot of support from colleagues and the service users.
It's been an emotional storm.
Extremely challenging, tiring.
We usually have 5,909 calls a day in London, and we were reaching 8,000 or 9,000 a day.
But also pride in working in a team that we managed to carry on and develop new things and provide good patient care.
It's been an incredibly challenging time for many people in lots of different ways, and we've all had different journeys.
The last 10 months has been somewhat challenging.
Lots of us have been redeployed to different areas.
And we now owe it to all our staff to make the recovery process be healing and go well.
We've gone through a really challenging time with sort of the impact of COVID.
I think it's really hard to look back on the past year and not feel proud about what people did. The partnerships that they formed, the relationships that they formed, the different ways of working that they adapted and adopted so quickly. And when you speak to staff now at the stage that we're in, actually it was the power of that team working, of the caring for patients, the professionalism across different areas is, I think, what sticks very much.
I found tremendous levels of support from every level, and I found people coming together more than ever.
Senior managers and line managers have never seen wellbeing as such an important topic.
It's really shown how different CCGs and different sectors across the system, when they really need to, can come together and work collaboratively.
I think it's probably moved us forward 5 or 10 years in terms of our use of technology. How do we cement and secure that longer term if we've got people who are enjoying the benefits of flexibility?
So health have been working differently. Our links with the communities and community groups and our third sector organisations have all pulled together.
We've developed lots of different initiatives like the communication campaign, mental health support leaflets.
And we have had support from leadership teams, from senior managers across the board.
It's been really encouraging to see people feeling free to express their concerns and their fears.
I feel everyone's pulled together, supported each other, working towards, I suppose, a common great goal.
At times it seemed as if everybody was going in different directions, but somehow it all came together in a remarkably short period of time.
But there's been a real sense of working together, whether that be with kind of the voluntary sector, local NHS service users. I guess there's been a real sense of community.
We've introduced lots of new wellbeing programmes and toolkits for staff.
We've come through this by working together and being together and building bridges rather than walls.
I think despite everything else, we'll come out of this as a much stronger team.
I'm a firm believer in providing people with the best possible psychological support.
You need to look after our staff. They're our most precious resource.
It's been a whirlwind, and hopefully we're near the end.